It's obvious that there's something going on with the insulin system in the brain that we don't understand. I mean, insulin in the rest of the body is used for sugar metabolism. In the neurons, it's not. Neurons will take sugar regardless of insulin. They have to have constant sugar, and so they're not going to depend on anything else. They're just going to take it right from the blood or right from the system. But they do need insulin to function properly. And for some reason, in people even who are not diabetic and they have Alzheimer's, the brain itself has become insensitive to insulin, so it's not functioning properly. Obviously, a person who has type 2 diabetes, this is going to be much worse because that's going to set their brain up to not be sensitive to insulin to begin with, and now they're not going to have the major protective system that will keep them from getting the Alzheimer's. Up until recently, we haven't been looking directly at diabetes. We simply have been looking at the cause of the neuropathy and treatment for the neuropathy. But in our brain studies in diabetes and Alzheimer's, we discovered that one of the primary chemicals that the brain makes, which is related to Alzheimer's, actually stimulated the insulin system in the brain as well. So this is our newest discovery that we're writing up right now. Well, if this chemical induces insulin activity in the brain, what would it do in the rest of the body? So now we've done some studies in the liver, and it turns out that this brain chemical, which is also made in the rest of the body, but it's made in higher levels of the brain, can induce the insulin action in the liver as well. So now we're writing a grant looking at, well, if we take stem cells and have these stem cells make large amounts of this chemical and put them, say, in a pancreas, could it replace insulin or possibly make the animal more sensitive to insulin? So yeah, we are now looking at treating diabetes directly. And it's gone from peripheral nerves, Alzheimer's, diabetes, and it moves where it moves. You follow the science, you don't direct the science.